So as we mentioned, the Western Cape has entered its third wave. It seems, according to the rising numbers, Gauteng is accounting for more than 50% of the infections, more than 8,000 cases being recorded on Wednesday in the 24 hours that were reported. We speak now to Professor Salim Abdul Karim. He's the director of CAPRISA and the professor of global health at Columbia University. He's, of course, a well-known public health specialist. A very good evening to you, Professor. Thank you so much for speaking to us.
Very good evening, Zafisa, and very good evening to all the viewers.
I mean, these numbers are alarming. Some people are saying there should be an immediate shutdown. Just how seriously concerned should we be about the rising numbers?
So we've known that for the last three and a half weeks, we breached the 5 per 100,000 in terms of the threshold we use for low transmission. And once we breach that, it's very difficult to slow the virus down. It is going to increase. And we know from our first and second waves that the virus will grow in 1 or 2 or 3 provinces initially. And then from there, it seeds the other provinces. In the first wave, it started in the Western Cape. In the second wave, it started in the Eastern Cape. And the third wave seems to have started in Northern Cape, Free State, and Gauteng. Now, the epidemic in Gauteng is growing rapidly. And that's evident by the rapid increase in the number of tests. So it means there are a lot more people coming forward for testing. I had about 53,000 tests yesterday compared to the previous week where we were averaging around 34,000. So a big jump in the tests, and the positivity rate has also gone up. And that's a concerning sign. It's telling us that we are now going into a situation where we're going to have to increase testing, more capacity is going to be needed. The hospitals need to be ready to take this on, because if Gauteng is increasing at the rate at which it is right now, it's just a matter of time before it will start increasing in the other, what I call the Indian Ocean provinces, the Western Cape, Eastern Cape, and KwaZulu-Natal. And we know that the provinces run about sort of 3 to 4 weeks behind the first province. So we should be expecting that now over the next 2 weeks, cases will rapidly rise in our Indian Ocean provinces as well.
So, Prof, just explain this to us. So if there's a spike in new cases, does that mean that the pandemic is trending upwards? Are there any particular factors that are influencing this, the winter season, for instance, and the mutation of the virus itself?
So there are 3 broad things that impact the wave. I mean, there are many things, but there are 3 broad things that we look at. The first is we get some idea of what the levels of pre-existing immunity are. And we know that in South Africa, our pre-existing immunity is still at quite a low level. It's not high enough to protect us, in that it's around 40-45% on average across the country, some areas being higher than others. And so we do not have a natural protection. And even if we did, the variant that we're currently dealing with would be able to escape past infection or past immunity from our first wave, as we saw in our second wave. So that's one issue we would look at. The second is we want to look at our mobility. And our mobility is quite important because the virus moves as we increase mobility. There are many studies now that look at cell phones and looking at cell phone data and looking at areas of high mobility because they become the hotspots for the virus. And then the third is we're getting some idea of how our behavior is impacting. And right now, because it's cold, we don't want to be outside. We get in, we lock all the windows, and we got our heaters on. And so we would have to expect that we are creating the conditions for the virus to spread. So those are three things broadly. We can look in addition to a range of other things, but those three things are really critical. If we look at where we are now in the epidemic, we are, in a situation where the weather has been quite cold, and it's a situation where we are still at a level that is, we only at level 2, so people are pretty much doing their normal activities. So they're maintaining their normal mobility. And so that's, a big challenge. And of course, in terms of our mask wearing and social distancing and hand washing, there's a bit of complacency that has set in because it's now quite a while since our second wave. So I think all of those things combine to give us the conditions where we are now going to see a rapid rise in cases. So we shouldn't get too concerned about the 8,000 because it's going to get a lot higher in the next few weeks.
And Prof, having said that, very sadly, according to the WHO Africa, 90% of African countries are going to miss their vaccination targets. So the question then is, as you mentioned, all those things that we're not doing that we should be doing, are there any new findings from a scientific perspective on prevention that we could glean from, that we could be applying?
I think there are some interesting new data that are coming out. The one was, if we look at as a backdrop, the analysis by Peter Klemek and others from the UK, they analyzed over 1,000 different government restrictions and interventions. And they looked at it in 226 countries. So, a really comprehensive study. And they've given us a sort of rank order in which different kinds of restrictions make a difference. And high on that list is gatherings, right? Number one is, the size of gatherings and the restriction of gatherings is critical. And right now, we are still allowing gatherings of 100 people, and that's not a good idea. And the reason for that is that as the cases are going up, the probability that you'll have a positive person, a person with infection, in that room gets higher. And the moment you have that, and if there's any breach in the requirements for ventilation, open windows, and mask wearing, you would end up with a situation where a lot of people would get infected. And then once that happens, it's very hard to contain thereafter because, you're just seeding the virus, in the community when everybody goes back home.
So what should we be doing immediately? Should harder lockdowns that are localized by districts be a possible solution or even consideration at this point?
So we've looked at that in retrospect. Could we have done that in the second wave? And the answer to that was, we would be chopping and changing on a regular basis. Every few days we'd be announcing new districts and we'd be taking off other districts. So it doesn't really work, especially because most people don't even know where their district boundaries are. So if we tell them, no traveling outside your district, they'll be wondering, so, is the local corner Pick and Pay or shop in my district or not? And they won't know that. So the better way to deal with this is to ensure that we have a set of generalized restrictions that people can understand, easily interpret, and implement, and understand that it will be done for a short period. There may be occasions, especially when we are in an early stage where you've got outbreaks, that's when these local restrictions are much more powerful. And that's where they have their benefit. But right now, as we are at least in the Northern Cape and Free State and Gauteng, it's just too generalized an epidemic to really make a difference. The issue that we have also considered in the past is, to what extent can we really restrict inter-provincial travel? Can we really protect, KwaZulu-Natal through limiting travel from Gauteng? Because that's where the cases are going up in Gauteng, they're quite low in KwaZulu-Natal. And that's very difficult because our whole commerce is based on the movement of people back and forth. So it becomes very difficult to do that without, it's quite severe restrictions that would be harmful in other ways. So I think right now, given where we are in the epidemic, we should really be at a level that we are individually concerned, and we need to individually make sure we are no longer complacent.
So, Prof, let me jump in on that. When you say where we are, on the pandemic, technically, have we entered into the third wave based on the incidence rate of COVID-19? I see the figures that were updated today is now we had a total of 9,149 new cases in the past 24 hours.
Right. So the South African Modelling Consortium has set up some criteria that is used by the Department of Health to determine whether we're in a third wave or not. That set of criteria is helpful in certain circumstances. But in reality, we've been in the third wave for quite a while, even though technically we haven't met a particular threshold. The reality is that several of our provinces are in the third wave. The country as a whole is in the third wave. The cases are rising across the country. Our 7-day moving average right now is about 5,500 cases. That's what we prefer to look as epidemiologists. We don't look at just today's cases. We look at a 7-day moving average. And a 7-day moving average of 5,500 cases, that's concerning because it means, just think about it like this, to get 5,500, or let's say you said 9,000 cases we had in the last 24 hours, those 9,000 cases, those infections occurred about 10 to 14 days ago. Right? Because from the time you get exposed to the virus, you actually get infected, there's about 3 to 5 days where the virus is now just growing in you. And from that point, you become infectious for another 3 or 4 days, and then you become clinically evident. You get symptoms, and that's when you go and test. So when you go and test, you've already been exposed 7 to 10 days ago, and now we are getting that report. So you can see that if we're saying there are 9,000 cases today, those 9,000 infections already occurred somewhere between a week and 2 weeks ago. So that means today, there's probably twice that number, let's for example say. And so we will know today's cases only in about 10 days' time or so, on average, yeah.
Thank you so much, Prof. So that also means that the test positivity rate, which was given today, is 15.7%. That will grow exponentially as well. Thank you so much, as always, for your time and your insights. Good to talk to you, Professor Salim Abdul Karim, who's a public health expert.